in different cities. And also right now we have a travel peak during the summer vacation, which also poses challenges for the spread of the epidemic. Once we found epidemic, we have to take decisive actions for the containment. We have to seize every minute to contain the spread of the virus. Good health habits and also getting vaccinated is the best effective way for us to protect ourselves. We have to stay alert and protect ourselves. For high-risk groups, they have to report their information in a timely manner and show their social responsibilities to fight against the COVID-19. As of August the 4th, we have over 1.7 billion people receive doses of vaccines. And today, we will continue to discuss issues related to containment of the epidemic. We have Mr. Liu Peijun from Ministry of Education, Mr. Chen Kai from Ministry of Industry and Information Technology, Mr. Yu Changguo from Ministry of Culture and Tourism, Mr. He Qinghua from National Health Commission, Mr. Lin Wei from General Administration of Customs to attend the press conference, and they will also answer your questions. Now the Q&A session is open. Please announce your media affiliation before you raise the question. With China Education Channel, now we are seeing more than 10 provinces in China reported local cases. In less than 1 month, the schools will open again. My question is, shall the autumn semester open as scheduled? What other considerations from the Ministry of Education? So I would like to invite Mr. Liu Peijun to answer your question. So first of all, thank you for your attention about the opening of school in fall semester. Start of July, we found the variant has been imported to China and which caused sporadic cases in multiple cities in China. Right now, the epidemic situation remains complicated. This also poses a challenge and uncertainties for the reopening of school in fall semesters. I believe you all pay a lot of attention on the prevention and control measures taken by the Education Department and also the semester arrangement. Right now, the Ministry of Education is working with education in different provinces, and we are analyzing the actual situation right now. And we are discussing the plans for the reopening of the schools. And before this new semester, the Ministry of Education will release notifications to make further deployment. As of now, we have several considerations. First, in the fall semester, we have to consider the overall interest. We need to put epidemic prevention and control as our top priority. The education system will fully consider the health and safety of our students and the schools. Also, we need to maintain a good teaching order and also consider the situation in China for the epidemic prevention and control. We need to shoulder higher responsibilities and take stringent measures to exercise the arrangement made by the government. And also, we need to take strict measures to contain the epidemic in different streets in China. And before the new semester, we have to take into several areas into consideration, making sure that people could stay safe in the universities and schools, and also we can maintain a good educational order in different schools. Second, as for the new semester, we also need to consider the principles under local jurisdiction. We will consider the reopening of the school according to the actual situation in different cities. By looking at the actual situation, universities, middle schools, high schools, kindergartens, primary schools have different situation, and also the epidemic situation varies from different cities. So as for the reopening of the new semester, we have to understand the local situation. So all of these epidemic prevention and control will be under the local jurisdiction. Of course, we will abide by the national guidelines for the epidemic prevention and control, so that we can better arrange the reopening of school in the fall semester. As for the exact date for the reopening of the semester, and also the epidemic prevention and control measures taken by the Ministry of Education, we will take customized strategy to different cities and provinces. By doing that, we could attend to different needs of different cities and have a good arrangement of the reopening of the school. But right now, as we have so many uncertainties posed by the epidemic, if we still have mid and high-risk regions before the new semester, according to our experiences in the mid and high-risk regions, we will postpone the reopening of the semester in those regions, and also these students will not come back to school as our original plan. So making sure that these students and teachers can stay safe. But the top priority right now is the Provincial Educational Bureau should focus on the reopening of the semester. They have to make judgments in advance and make arrangements in a proactive manner so that they could guide the local schools, universities, and middle schools to have a good order and come up with an effective epidemic prevention and control measures. Also, the schools should serve the students and the teachers during the pandemic, and they also need to do a good disinfection in the public facilities. All in all, they have to do what they can to fully prepare for the new semester. Third, as for the arrangement for the new semester, we need to work with multiple departments to make sure all the work can be implemented successfully. As for the prevention and control during the summer vacation, the Ministry of Education is working with Provincial Educational Bureau. So all the work is underway. First, before the summer vacation, the Ministry of Education published a notification strengthen the epidemic prevention control work. We guide the local education department to exercise normalized prevention and control measures. And during the summer vacation, we are providing a lot of education to the students to protect themselves, so they are well aware of the prevention and control measures. And during the summer vacation, which is from late July to late August, in accordance with the changes of the epidemic, Ministry of Education published 2 emergent notifications. We are guiding the local educational bureau to activate the emergency response mechanism. They are providing more education to the teachers and students on how to protect themselves. And also, these schools will not allowed to host large-scale gathering. And also they have to work to prepare for the reopening of the new semester. Third, we have to pay attention to the back-to-school season, which is in mid-August. The Ministry of Education will take a number of measures to guide the back-to-school season. Hopefully, the work can be done successfully. First, we will publish a notification on back-to-school working guidelines. we will work with Provincial Educational Bureau to have a video conference. Also, we are organizing a special meeting to invite experts to provide counseling to different schools. And also, we will work with CDC and the Health Commission to publish technical guidelines on epidemic prevention and control in universities, middle school, high school, primary school, as well as the kindergarten, making sure that all the epidemic prevention and control measures could be implemented effectively. We are making sure that all the measures can be implemented thoroughly. Second, we will work with CDC and the National Health Commission to have all the students and teachers in school getting vaccinated. Thank you. Next question. With First Finance, right now, the Delta variant is the cause for the global pandemic. This is also the variant causing the Nanjing pandemic. There were many considerations about the Delta variant. Can you tell us more about the features of this variant? I would like to give the floor to Mr. He Xinhua to answer your question. Thank you for your question. As for the Delta variant, it was found first in India in September 2020. Last year in May, WHO announced that for the Delta variant has been included into one of the key variants. So right now we found this variant in over 130 countries, and this is the major variant causing the pandemic in different countries. So for this variant, it has fast transmission, fast replication, and fast transmission. So right now, according to scientific analysis, Delta variant did not change the nature of the coronavirus. As for the infection source and also the transmission route still remain clear. Right now, the vaccines also protect against the Delta variant. It could also help us to protect ourselves against the variant. And also, the current prevention and control measures are effective to the Delta variant. And also, the vaccines right now could also protect ourselves from getting infected from Delta variant. Also, it will reduce the risk for the patients to turn into severe cases. Previously, we found in Guangdong province, we are able to curb the spread of the Delta variant. It is the first time we found Delta variant in Guangdong province, and as Guangdong is densely populated, but still, the Delta variant did not cause a large-scale pandemic in Guangdong province. This also means by getting vaccinated, it will help to reduce the infection caused by Delta variant. Through this pandemic, we could see by having people getting vaccinated, it will reduce the risk for people to get infected and also lower the speed for the transmission of the virus. And of course, we have to take a regular prevention and control measures, for example, wear a mask, wash our hands, and exercise social distancing. Also, these kind of measures are proven effective to fight against the new variant. Thank you. Next question, please. With People's Daily, recently we found the communication code always have some issues. My question is whether the MIIT will take some measures to fix the health code and the travel code so that people could use this code on a regular basis. Thank you for your questions. For the MMIT, attach great importance for the epidemic prevention and control. We also follow the guidance by the State Council's interagency task force. Since the outbreak of the epidemic, the MIIT also provide guidance to the IT branches under MIIT. And we are providing the travel code and the travel card to the local residents. And right now, we are able to find travel history of over 12 billion times. And it will help us to manage the travel history of our local people and also help us to resume our work and the production. So the travel card is of utmost importance for us to understand the people's conditions. As you said, recently there were cluster outbreaks in different cities in China, and also the situation is getting more severe and more people tend to use the travel code. And we have limited resources for the maintaining the travel code. In certain peak hours, for example, in the morning between 8 o'clock to 9 o'clock, so for certain time period, there will be a crackdown in the system, so people are not able to use the travel card and the travel code. And after we found this situation, we work immediately with the R&D centers to take emergent actions. First, we expand the loading of the server so that we could meet the needs of the inquiry of the travel code. Also, we optimize our systems and improve the capability of our system. And third, we have end-to-end pressure tests to make sure that after we enlarge the capacity, the travel code can still be used on a daily basis. China Telecom, Unicom, and China Mobile have shown great support in us to resume the use of the travel card. If you look at our official WeChat, you could see some of the notification from the MIIT. If you are not able to use the travel card, you could actually send text messages to receive your travel history. And in the future, we will take more effective measures to ensure the card can be used effectively. First, we will continue to expand the capacity of the system, improve the structure of the IT system, making sure that the travel card can meet the needs of the epidemic situation. And the second, we will step up our efforts to identify the unusual situation. And third, we will provide more contingency plans to improve the inquiries and the checking of the travel card. Thank you. Next question, please. With Phoenix TV, right now the global pandemic is still accelerating. Nanjing, Xiamen, Shanghai also reported local cases. All of these are actually related to overseas airlines. So my question is to the customs. What measures we are taken at the borders to contain the imported infection? So first of all, thank you for your attention to our work from the General Administration of Customs. As you said, recently the global pandemic is still accelerating, and also we found variant. Also, we have the fast transmission of the Delta variant. This also poses pressure for us to prevent the imported infection in borders. In view of this situation, the GAC has made a lot of deployments. We have taken a number of stringent measures to contain the spread of the virus. We have taken many methods. We will not slacken our efforts. We will maximize our efforts to mitigate the risk of the transmission of the virus through the borders and the ports. We have taken the following measures. First, we will take stringent measures at the borders, especially for the border checks and the entry screening. Since the outbreak of the epidemic, in airport, land port, and the seaports, we will check the health declaration form for the inbound travelers. We will also conduct epidemiological investigation and NAT to inbound travelers. So we will strictly review the health declaration form for the inbound travelers. For all the suspected cases, we also do a screening to these people. To all the inbound travelers, we will take their samples for testing. For cases show positive results, we'll report these cases to upper level. For the Customs Department, we'll also work with local government to make sure that all these suspected cases can be transported to designated hospital. We will also roll out a closed-loop management, making sure that all these people can be sent to quarantine as soon as possible. Second, we will pay a lot of attention in containing the spread of the virus from the airports. We are conducting epidemiological investigation, and especially we roll out the investigation to key groups of people. We will try to shorten the clearance time for the inbound travelers. We want to curb the spread of the virus inside of the border. During the epidemiological investigation, we will have physical isolation zone, making sure that we could reduce the risk of cross-infection. Third, we will take a lot of measures to contain the spread to the air crew. We will follow the guidance from the State Council's Interagency Task Force. We will done strict screening to the air crew for international cargo flight and also the air crew for passenger flight. We also work with local authorities on the epidemic prevention and control measures. We'll clarify responsibilities to 4 parties, making sure that the virus will not be transmitted inside of the border area. And of course, we will try to protect our staff members who are working at the borders. For the frontline workers at the borders, we will check their health condition every day, and also we have a shifting management for these people, making sure that all the working staff get vaccinated so that we could reduce the risk for them to get infected. Second, we will provide training to our working staff so that they can raise their awareness for the epidemic prevention and control. At the same time, we'll provide psychological counseling and humanitarian care to people who are working at the front line at the border so that these people can discharge their duties and protect the safety at the border. Thank you. Next question, please. With Beijing Broadcasting Center, and we do have a peak for the travel during the summer vacation, and I believe these will pose some of the challenges for the spread of the virus. My question is, what measures will be taken by the Ministry of Culture and Tourism to contain the spread of the virus? I would like to invite Mr. Yu Changguo to answer your question. Thank you for your question. Indeed, it is a peak time for people to travel during summer vacation. In view of the current situation, the Ministry of Culture and Tourism attaches great importance according to the deployment from this CPC Central Committee and the State Council. We are taking stringent measures to contain the spread of the virus through culture and tourism. First, we will provide more guidance to local authorities. On July the 29th, we have already issued a notification requiring all the cultural and tourist attractions to get aware of the actual situation. They should stay alert and never slacken their efforts in epidemic prevention and control work. They have to focus on key links, and they should be under the guidance of the local authority and to exercise the prevention and control measures in the tourist attractions. On August the 3rd, our ministry once again issued another notification to further strengthen the prevention and control of the epidemic among tourists. They should take stringent measures on the prevention and control work. As for the measures, for all the tourist attractions and the travel agencies, they should analyze the situation and understand the risk level in the tourist destination. They will not organize a group to travel to the mid and high risk regions. And also, they will not organize a tourist group from the mid and high risk regions to travel outside. And also, they have been aware of the latest situation about the epidemic locally. For certain places, if they have been upgraded into mid and high risk regions, the travel agencies need to change their travel routes. For travel agencies or travel groups already in the mid and high risk regions, they should suspend their travel and abide by the epidemic prevention and control measures. And also, they have to pay attention to the workers who are working in the travel agency. Before they start their working, they need to have their information register and also have their temperature check. If there are some of the travel agency workers develop symptoms such as fever, coughing, these people should go to hospital for treatment. Going forward, we have to abide by the latest prevention and control measures and manage the travel activities in different cities in China. To high risk and mid risk regions, we will suspend all the travel activities in those regions. After those places have been downgraded into low risks, then we will resume the tourist activities. Also, we will provide more supervision to different cities on the travel. In Zhongzhou, after we see the epidemic started, the Ministry of Culture and Tourism also dispatched a task force to go on site to provide support on the epidemic prevention and control. Also, we are working to evacuate the tourists who are staying in Zhangjiajie. At the same time, we're also rolling out the epidemiological investigation to all the travelers staying inside of Zhangjiajie. Next question, please. With Hongxin News. Right now, we are at a critical stage on the epidemic prevention and control. We need to find out all the risky groups and roll out the epidemiological investigation into those areas, into those people. Right now, we are rolling out this work in several cities. So can you tell us more about the measures taken by the interagency coordination? Thank you. I would like to invite Zheng Kai to answer your question. MIT attach great importance to the epidemic. We implement the decisions made by the State Council Interagency Task Force. We roll out the contingency plan. We also organize the video call. This will help us to coordinate different regions and the cities to fight against the epidemic. First, we improve the inter-city coordination. And also, we are able to form a synergy. So for us, we will work with the Health Commission and Public Security to check the situation in different cities in China. We also organize special task force. For example, the Information Technology Department will provide some technical support so that we could understand the big data for people who are stranded in those areas. We are working with different disciplines to provide support in conquering the epidemic. Second, we will step up efforts to share the data and information across different cities. We will analyze the situation in Nanjing International Airport, number 6 hospital in Zhongzhou, and Zhangjiajie. We try to understand the flow of the travelers and the people from those 3 places. By understanding the data, we can find out the suspected cases and the risky groups of population. Third, we will step up our efforts to build up the platform so that we have a better algorithm to understand the current situation. We will make good use of the calculation of the big data in view of the epidemic in different districts, we are actually working on a new application so that the medical workers could collect information about the new cases and report those new cases in the application. In general, for the intercity task force, they have made good use of the big data and the relevant application, and also these applications have played a key role in containing the epidemic in different cities. In the future, MIIT will continue to follow the guidance of the State Council's Interagency Task Force, and we will work with members from the intercity task force and to check the information from people who are living in those areas. And also we accelerate the launch of the application, making sure that we can improve the efficiency to upload the information of the risky groups. Third, we will also offer supervision and guidance for people who are using the application. And also we will do a timely troubleshooting on the application so that we can play our role in fighting against the epidemic in China. Thank you. Next question, please. With the paper, according to the latest situation, the epidemic started in Zhongzhou from the number 6 hospital. It also involves the cleaners and medical workers in the number 6 hospital. Maybe it will show some of the weakness in the nosocomial infection. I would like to understand what measures will be deployed by the National Health Commission to contain the spread of the virus inside of the hospital. Actually, today we have a deputy from the National Health Commission, and she will answer your question. Thank you for your question. So after we hear the news there's a cluster outbreak in number 6 hospital in Zhongzhou, we attach great importance to that issue. We dispatch a task force to Zhongzhou, and we work together with the local experts to understand the actual situation. And this is actually a case found from the nosocomial infection. According to the gene sequencing, for the confirmed case, actually she was infected of the virus from one imported case. And also this case was infected with Delta variant. So I would say for this one asymptomatic case, this has no relations to the Nanjing epidemic. So we found 3 issues from the epidemic outbreak in Zhongzhou. First, I believe the local authorities do not have a good awareness of the prevention and control measures in Zhongzhou. Especially, they do not have a good understanding about the complexity of the Delta variant. They lowered their guards in the epidemic prevention and control measures. And also, I believe the supervision work of the Zhongzhou Health Commission is not well placed. The local health commission, they are not doing a good job in providing guidance to local medical institutions. They are not able to find out risks and make improvements. Third, for the medical institutions, when they are exercising the measures to contain the nosocomial infection, they are not doing a good job. For the local officials from the medical institutions, they are not able to identify the risk and then causing the nosocomial infection. This eventually leads to the cluster outbreak in the number 6 hospital in Zhongzhou. I believe all of you are aware that for all the people involved have been held accountable for this outbreak. Immediately, the National Health Commission also organized a video conference. We call on all the localities to learn lessons from the situation in Zhongzhou. And also, we are rolling out trainings to all the localities so that they could better understand the hidden risks of the nosocomial infection. We require all the hospitals to exercise the measures to prevent the nosocomial infection, to make sure that there's no transmission of the virus from the hospital. Thank you. Next question, please. The key is to find out the source of the virus to contain the spread. And right now we are seeing cluster outbreak in different cities. So what are the investigations right now? So for people who have visited the mid to high-risk regions, how could we contain the spread of the virus from this group of people? I would like to invite Mr. He Qinghua to answer your question. Thank you for your question. You mentioned many cluster outbreaks in China involving 15 provinces, and we do see some confirmed cases in these parts. And for places with confirmed cases, I believe the local government, they also follow the arrangement from the State Council CPC Central Committee and the State Council Interagency Task Force. They will come up with contingency plans in accordance with the actual situation of the local places. In general, the situation is controllable. As you can see, this time the epidemic covered a number of places. And also this epidemic is related to imported cases as well. This also poses a lot of challenge for the screening and also increase the complexity of the epidemic. So we need to take strict measures on all the prevention and control work. I believe in a short period of time, we are able to contain the epidemic. Next question, please. With CMG CCTV, recently, in different places, they already published notification to restrict the population flow, especially for people staying in the mid and high-risk regions. So by having that notification, meaning that some of the students, if they travel in those mid and high-risk regions, they're not able to go back to school. How we handle this situation? First of all, thank you for your question. I believe after the new semester starts, some of the students are not able to return to school. And thank you for your care to this group of students. Right now, we do have some uncertainties of the epidemic and also some changes of the policies in different cities in China. And also, we do see there are some restrictions on the population flow in mid and high-risk regions. Before the new semester starts, it is likely that we still have the mid and high-risk regions in China. If students who are staying outside their hometown, maybe they're not able to go back to their hometown and go back to school. So you are paying attention to the livelihood for this group of students. So for the Ministry of Education, we will pay attention to 3 areas. First, will strengthen the coordination. In mid-July, we have released a notification. We are guiding the Provincial Educational Bureau to fully study the prevention and control measures. And we need to come up with a customized plan to each one of the schools, universities. We have to consider the needs of people who are not able to return to school in the new semester. We need to provide support to this group of students. Also, we will offer psychological counseling to this group of students. Second, we strengthen the closed-loop service. We have already gained some valuable experiences. In the past 1 year, the education system suspended class and reopened the school for several times. So for students who are not able to go back to school in the new semester, they will be included into our service scope. During summer vacation, there may be some students staying in the universities and schools, and also after the new semester starts, some students may not able to go back to school. So for students who are staying in the schools, we will offer some livelihood support. So these people should themselves have a very comfortable life in the schools. And for students who are not able to go back to school, we will offer online courses. So even though these students staying at home, it feels like they are going back to school. No matter where they are, whether they're in school, at home, or in their travel destination, the Ministry of Education will put our students' safety as the top priority. And also we will consider their actual situation and provide support in their studies, and also we will provide psychological counseling to these people. Third, we will provide all-rounded support and guidance to the students. After we preparing the reopening of the school, we will consider this special group of students who are not able to go back to school in the new semester. After the new semester starts, if these students are not able to go back to school, we will organize online classes to make sure that these students can catch up with the others. So after these students are able to go back to school, according to the local prevention and control policy, first of all, we will bring these students back to school by batches and by different groups, and of course, we will monitor their health condition. When necessary, we will provide extra aid to these students so that they could catch up with the other students. Still, we are facing with a lot of uncertainties caused by the epidemic. Back to school is very important for the education department. So we will work with local education bureau. We will try our best to provide support to the students. And for the schools, they will also show support to the students. And we will also provide targeted services to different group of students. Thank you. Next question, please. For this round of epidemic in Jiangsu, Hunan, Beijing, and we do reported several cases. Does that mean we're out of control for the epidemic? What is the current situation of the epidemic in China? What is the future trend? what measures will be taken by China to contain the spread of the epidemic? I would like to invite Mr. He Xinhua to answer your question. Thank you for your question. As you mentioned, in China, we have 15 provinces reported confirmed cases. And different places and cities abide by the arrangement from the CPC Central Committee and the State Council. Also, they've taken proactive actions to contain the spread of the epidemic. Right now, the situation is controllable. However, this wave of epidemic cover a wide range and also affecting a group number of people. We are also impacted by the imported cases. This will also increase the capacity of the epidemic. I believe as long as all the cities can exercise epidemic prevention and control measures, I believe this round of epidemic could be contained. At a national level, I would say for certain places, there may be new cases reported. For different cities, they have to stay alert and making sure that they could minimize the impact of the epidemic. We have to abide by the normalized prevention and control measures and the general guideline of prevent imported infection and domestic reemergence. And based on our previous experience, our prevention and control measures are proven effective. So at a national level, yesterday, Vice Prime Minister Chunlan also organized a video conference. The National Health Commission also make arrangement to contain the epidemic. After the video conference, National Health Commission dispatched over 20 task force to guide the prevention and control in different cities. So I call on all the localities to take a science-based approach to take effective prevention and control measures. We have to do a fast reaction in handling all the confirmed cases. So first of all, we need to activate the emergency response mechanism to take effective control in places with confirmed cases. We need to screen out how many people were infected. And also we need to work with multiple departments to find out the close contact and the secondary close contact as soon as possible, making sure that these people can be brought to centralized quarantine as soon as possible. And also we need to use TCM as well as Western medicines to treat the patients, making sure that their symptoms can be contained and not be turned into severe cases. At the same time, we need to show support to the local residents. And also, it reminded me of one of the questions raised by foreign correspondents. Earlier, you asked about how can we handle the people who used to pay a visit to the mid to high risk regions. First, we have to contain the source of the infection. First of all, we have to isolate the source of the infection, and this will help us to cut off the transmission route. So, for people who used to visit the mid and high risk regions, so these people, they are risky groups. First, we need to identify the scope, and then we need to trace down on the travel history of all of those suspected cases or the risky groups. And also, if some people, they are still in their travel, so we have to suspend their travel immediately, because all these people are high-risk groups. So for every individual, they need to show their responsibility not to pass the virus to others. And as for the prevention, under the normalized prevention and control, we advise all the local people to wear masks, exercise social distancing, and avoid gathering. And of course, they should not spread rumors. and they have to abide by all kinds of epidemic prevention and control measures. And also, they need to get vaccinated as soon as possible, because right now we're providing the vaccines free of charge. And the second, I would use one word, that is reduction, meaning that you have to reduce the number of travel. If unnecessary, do not travel outside of your city, so that it could reduce the risk of transmission of the virus. Especially, we have to pose restrictions on the population flow in the mid and high-risk regions. Third, reporting. Once we found suspected cases, we have to report relevant information. We have to pay attention to the statement published by the local government. For people who used to visit high-risk and mid-risk regions, they have to report their travel history in a timely manner. So that's why some people may receive a text message from the MIIT. If you receive a text message from the MIIT, make sure you report your personal information in a timely manner. When necessary, you have to go to a hospital for centralized quarantine. And if you develop symptoms such as coughing, fever, make sure that you visit the nearby clinics for further observation and treatment. So when you are going to the hospital, make sure that you do not take the public transportation. And of course, do not visit your relatives or go to public facilities that have been densely populated. So these are the work that need to be done by every one of the individuals. So we have to make sure that everyone can make our own contribution in fighting against the epidemic. Thank you. Next question, please. Xinhua News Agency. So we believe for the tourist attractions, museums, libraries, and cultural pavilions, these are all public recreational facilities, and these places are quite densely populated. So what measures will be taken by the Ministry of Culture and the Tourism to deal with this situation to contain the spread of the virus? So right now we do see cluster outbreak in different cities in China. The Ministry of Culture and Tourism attach great importance to this issue. We also guide the tourist attractions to follow the guidance from the prevention and control mechanism. First, we need to have a fast reaction and to improve all the different localities to improve their capabilities in fighting against the epidemic. We will follow up the implementation of the measures in different tourist attractions. For the tourist attractions, they have to abide by the local regulation and adjust their prevention and control measures. As of August the 4th, 1,152 A-level tourist attractions were closed to the public in accordance to the local authorities. And the second, we have to limit the number of travelers in the level 1 tourist attractions. Also, we encourage the travelers to make appointments before they visit these tourist attractions and advocate off-peak travel. We also need to register all the travelers' information. So as of now, 95% of the tourist attractions in China already advocate appointment system, and also we are making use of the big data information. We are releasing notification to the A-level tourist attractions. We are also providing evidence for these tourist attractions to limit the number of travelers. And also, we need all the people to have their information registered, have their temperature checked before they enter into the tourist attractions. And of course, they have to wear a mask and exercise social distancing. And also, we have to implement the prevention and control requirements in key areas such as the transportation hub, the accommodation places, catering places, sightseeing sites, and the shopping malls. And we are trying to provide contactless contactless service to the travelers. And also for the confined spaces, we are also announcing new measures. For example, for museums, theaters, cultural pavilions, libraries, and a number of indoor facilities. For these confined spaces, we need to strengthen the disinfection and the ventilation. And we do not allow these confined spaces to organize indoor activities. For people who need to enter to those confined spaces, they need to have their personal information registered and also have their temperature checked. And when necessary, we need to make sure that the number of visitors and the number of travelers shall be limited to these tourist attractions. And also, we are postponing some of the large-scale tourist activities. As of August the 4th, among 31 provinces, we have closed 250 libraries, 232 cultural pavilions, and museums. Thank you. Next question, please. With Hong Kong media. For the Ministry of Culture and Tourism, they have announced a number of measures. And what advices will be provided by the Ministry of Culture and Tourism to the tourists during their travel in summer vacation? Thank you for your question. Actually, summer vacation is a peak time for the tourists to come out for travel. Actually, in late July, we already sent out a safety alert. We would like to advise all of these travelers to raise their awareness to fight against the epidemic. So first of all, they need to abide by the epidemic prevention and control measures. They need to understand the epidemic situation in the destination and do not travel to the mid and high risk regions. And if you're already in those mid and high risk regions, please abide by the local regulations on prevention and control. And for people who are staying in the mid and high risk regions, do not go outside. Second, make sure that you mind your own safety. So for all the travelers, please stay alert. Make sure you get vaccinated and abide by the prevention and control regulation. Wear a mask, wash your hands frequently, no gathering, and also to stay in a place with good ventilation. So when you are taking the public transportation for travel, make sure you exercise in distance with others and do not dine with other people. When you're coughing or sneezing, making sure that you cover your nose with your elbow. And if you develop symptoms such as fever and coughing, make sure that you go to the nearby hospital for treatment. Thank you. Next question, please. My question is about the community prevention and control. I am aware that for certain communities, they have taken a very strict prevention and control measures. So what is the role for the prevention and control taken by the communities? I would like to invite Mr. He Qinghua to answer your question. Thank you for your question. As you said, community is the key for us to contain the spread of the epidemic. This will help us to mitigate the risk of the spread of the virus. And this will link directly to the effectiveness of the containment of the epidemic. First, we have to clarify responsibilities to four parties and also play a key role to the party leaders. For communities, if we found one positive case, we have to roll out the lockdown management for this community. And also we have to transport the confirmed cases, close contacts, and the secondary close contacts to nearby hospital for treatments and observation. And the second, for people who are living inside of the lockdown area, make sure you do not go outside. And also we will provide livelihood support to these people. And for residents who are living in the lockdown areas, make sure you receive the nucleic acid testing and do a good job in the garbage sorting. And for the other communities, making sure that you do a normalized prevention and control measures to people who travel inside of the community. For example, we need to check their temperature and also have these people scan the health code. Actually, for some of the grassroots officials, they have done a good job in containing the spread of the virus. And for the local communities, they also checking the travel history for people who visited to their communities. And also we have a standard procedure to check the NAT results for people who used to receive the nucleic acid testing. So we are trying our best to show support to the local residents and making sure that the NAT testing can play a key role. And this time, we are giving a lot of responsibilities to the local communities. So they need to check different codes for the local residents, and we have to mobilize all the available resources to identify the risky groups. By having all of those work, we need to mobilize all the people who are staying in the community. By doing all of the work, we are able to contain the spread of the epidemic. Due to the interest of time, 2 last questions. Recently, we found confirmed cases in multiple cities. For certain cities, they didn't report for confirmed cases for a long time. My question is to Mr. He. Does that mean for these cities, they let their guard down? What measures shall be taken by these cities to step up their efforts in the prevention and control? As you said, if we look at the cluster outbreak, for certain places, they didn't report confirmed cases for such a long time. For local people and local officials, indeed, they let their guard down, and also they think the places they're staying in have no risk. Yes, indeed, they slacken their efforts. We do have some loopholes and weakness for those places. For certain places, as they haven't reported confirmed cases for a long time, they think the epidemic will not hit them. So I would like to use some of the examples. For certain places, they do not have a sound emergency response mechanism. And the second, for these places, they are not exercising prevention and control measures because they always have this idea that the epidemic will never come to their city or their places. And third, for certain places, they are not exercising lockdown management in high-risk regions. Also, they are not making good use of the big data and the high technology to guide their work in the epidemic prevention and control. In view of this situation, especially for places that do not have confirmed cases, they still need to be aware of the severity and the complexity of the epidemic. They have to step up their efforts to look at each one of the weaknesses and to do their best to build up a protection net. I would like to call on 5 aspects. First, we will give full play to the party leaders and to clarify responsibilities for 4 parties. For local government, they have to initiate the emergency response, and also they need to provide annual report and monthly report and even daily report. We have to monitor the situation of the epidemic. For each places, they need to report the cases in a timely manner. If they found any positive cases, within 2 hours, they have to report this information. Once they found positive cases, they need to report the situation. Third, we will continue our efforts to screen the high-risk group of population. By no time, we have to trace the travel history of these people and also to roll out nucleic acid testing to these people. And when necessary, we have to bring new group of people for centralized quarantine. Fourth, for the communities, they have to exercise normalized prevention and control measures. For example, wear the mask, scan the health code, and have their body temperature check. For certain communities, we need to call on all the local residents to get vaccinated and participate in the nucleic acid testing proactively. And also, in certain places, for example, the road transportation checking points, airports, train stations, we also need to provide trainings and guidance to the working staff who are staying in those places. We also need to increase the frequency of nucleic acid testing, make sure that we can exercise all the normalized prevention and control measures. Thank you. One last question. With China use paper. Right now, we start the vaccination to people from 12 years old to 17 years old. So my question is, what is the role for the Ministry of Culture and the Tourism and Education Ministry to facilitate the work of the vaccination for young students? I would like to invite Mr. Liu Peijun to answer your question. Thank you for your attention to the progress of the vaccination to the students and the teachers. Under such context, it is crucial to have the students get vaccinated. And also it will help us to build a protection net in the schools. By having teenagers getting vaccinated, it will also ensure the health and safety for these people. Recently, the Ministry of Education have published 2 notifications. We have made arrangements for epidemic prevention and control in schools. Especially, we emphasize on the vaccination to eligible students. We guide the local education bureau to roll out the vaccination to eligible students. According to our regulation, it is the local jurisdiction's work to roll out vaccination to the students and the teachers. So right now, the Provincial Educational Bureau is working with the Health Commission and the local CDC to vaccinate eligible group of students. Second, we will provide more guidance and publicity. For the Provincial Educational Bureau, they are guiding the schools and also advising the parents to have the students getting vaccinated. We need to have this group of people to understand what is the vaccination progress and also how to roll out the vaccination. And the third, we have to ensure the safety of the vaccination. So I believe for the Provincial Educational Bureau, they are doing a good job in understanding the importance of the vaccination. So after the students agree on getting vaccinated, the Educational Bureau will work with local medical institutions to roll out the vaccination to students falling in the group between 12 years old to 17 years old. For the vaccination for eligible students and the teachers is going well. According to the situation of the epidemic, it is proven that it is effective once you have the vaccination. For people who get vaccinated, still they have to stay alert. They still have to mind their own protection Vaccines can provide us an effective protection net and isolate us from the virus, but still we need to pay attention to the personal protection. No matter where you are, you need to mind your own hygiene, you need to wear the mask, wash your hands frequently, make sure that you do not form gathering. You need to protect yourself first so that you could protect your family members and the whole society. Thank you. Thank you all the speakers in today's press conference. They have given us a lot of introduction and updates about the epidemic containment. Thank you again for their introduction. In the last question, actually I could see many journalists, they still want to raise more questions, and we will host more press conference to address your concerns. That's the end of today's press conference. Thank you.